Hello. Hi. Hello. And good evening, everyone. And welcome to another edition of our monthly Facebook live talk session. My name is Andrew, and I'm the head of fundraising, marketing, and volunteer management at 365 Cancer Prevention Society. Now, I hope everyone has taken your dinner and is all ready for our very hot topics for tonight. Just like our weather, right? It's really hot these days. So yeah, so for some of you, you find that tonight's topics is pretty interesting and perhaps very informative to you and also your family if you are someone who happens to stay out in the sun for quite a bit, or you're simply a sun lover. So if you know of anyone, your family or friends who are such people who enjoy the sun, so really do show them and join us, for tonight's session. So it's certainly a session not to be missed, right? Okay, so tonight's topic is about skin cancer and understanding the risks and treatment. Now, it's specially brought to you by, of course, 365 Cancer Prevention Society and our esteemed medical partner, Icon Cancer Center. So please like and share now, right, so that more people could get on onto this session and know about it. And yeah, or simply say hi in the comment section, and so that we know that you guys are all ready for the session. And yeah, like I say earlier, right, if you are a sun lover, tonight's topic would definitely be worth your time. So yeah, better stay tuned and hang around, right, for our guest speaker to bring you more information about skin cancer. And also for those who have participated in our recent Facebook contest, do stay tuned, of course, right? Because after the talk, we'll be announcing the winners. So, congrats and good luck to all who have participated in the Facebook contest, right? All right. So, 365 Cancer Prevention Society, who are we? So, we are founded in 2003 as a social service agency with IPC status and is a full-fledged member of NCSS. Now, the society mission is to serve the community through holistic cancer preventive measures, right? This is accomplished through health and nutrition education, promotion of a healthy lifestyle, and lymphatics detox exercise programs. We also provide practical and emotional support and care for our patients and their family members in their battle against cancer through residential and hospital visitations, counseling, and wellness services. Please remember that one is never alone in the fight against cancer. We hope you can join our community in the fight against cancer today. For more information and to stay up to date about 365 CPS, our activities and events, do visit our official website. Follow us on Facebook, Instagram, and Telegram. So don't forget to like, share, and comment on our social media pages too, so that more people can benefit from our charitable work. And I would also like to take this opportunity to announce that, yeah, 365 Cancer Prevention Society is moving to a new home. So do check out our website and also our social media pages for where our new home is going to be. For all you know, that might be another Facebook contest coming up, right, for you to win some prizes, right? Now, before we proceed with tonight's program, kindly note that all information shared at this session by the speaker and 365 CPS is for general information only and subjected to changes. Do consult your doctor for personalized and detailed medical advice if you have any. We respect your privacy, so please make sure that your questions are not too personal and it is something that we can share with the rest present here. Also, do let others have a chance to ask their questions too, right? So, thank you very much for your cooperation. Now, to mark Colorectal Cancer Awareness Month earlier in March this year, Icon Cancer Center and 365 CPS decide to jointly organize the My First Colonoscopy campaign. Together with partners, the Society of Colorectal Surgeons and StarMed Specialist Center, this campaign seeks to support individuals ages 45 to 70 years old from low-income families and those who are at higher risk due to family history and symptoms to a fast-track sponsored colonoscopy by experienced surgeons of the Society of Colorectal Surgeons, complete with a pre and post GP medical consultation at StarMed Specialist Center. Meaning the beneficiary of this sponsored colonoscopy doesn't have to wait months for an appointment to see a doctor or to do the colonoscopy. Everything is done at StarMed Specialist Center, one-stop shop, right? By qualified and experienced specialists from seeing a doctor to the scope, all in a matter of weeks only. And you guys are the ones who are making all this possible. Now we are still quite far away from our fundraising target so that we can dish out more sponsored colonoscopy. So I sincerely appeal every one of you to come forward and support this wonderful and worthy campaign. So how can you support this awesome campaign? You can do your part in saving another by donating generously. Details are on the screen now, so do scan the QR codes and check out our Facebook page, the online donation portals, giving.sg and GiveAsia, if you would like to make a donation. Now, if you want to know more about Icon Cancer Center, StarMed Specialist Center, and the Society of Colorectal Surgeons, do check out their website and Facebook pages right now. Now, on tonight's topic, we talk about skin cancer, and please do not be too alarmed. All right, if you found skin tags or keloids or even mole on your skin and thinking that that's skin cancer, no. Tonight's guest speaker would definitely let you in. What is skin cancer? Because in Singapore, non-melanoma skin cancer is the sixth most common cancer for males and the seventh most common cancer for females. Learn more about it, all right, in terms of the different skin cancer types, symptoms, treatments, and prevention methods. Now, tonight's guest speaker is no stranger to our Facebook Live talk session. He's none other than Dr. Yip, or rather Dr. Xiang Yip, who is a senior consultant and specialist at medical oncology. I beg your pardon. For many of our, regular attendees of our Facebook Live talks, I believe most of you would have remembered Dr. Yip by now, right? And once again, we are very, very honored, right, indeed, to have Dr. Yip, right, in tonight's session. So let us all welcome and thank Dr. Yip for joining us tonight and being our guest speaker for tonight's sessions. So, Dr. Yip, welcome once again. Good evening to you.
Hi.
And
Good evening.
I'm sure our audience tonight would be very pleased once again to see you and also hear from you about skin cancer, right? So.
Yeah.
I guess without further ado, I'll pass the time over to you, and I'll see everyone later soon. Thanks.
All right. Thanks, Andrew. Hi, everybody. Hi, good to be with you all again. I don't know who is here. As with a Facebook Live, it's always a bit funny because it feels like speaking to a screen. By faith, I believe there are people out there listening who are interested in this topic. I think the last time I was here, I spoke about colon cancer, which is actually the most common cancer in males in Singapore. And today we're going to talk about something that's a bit less common, but still, among the top 10 cancers among males and females in Singapore. So something still worth learning about. And so we're going to be talking about skin cancer. So just a short half an hour talk, and then we'll leave plenty of time for questions and answers. Now, the main thing about Facebook Live, for me, right, I really see Facebook as social media, right? So it's something, very casual. Usually, when you click on the social media like Facebook, usually don't handle such heavy going topics like cancer. So let's bring this down a little bit and to say, let's make this casual. And I think the most helpful way for everybody to get something out of tonight is not so much my lecture, but really the question and answer. So you can feel free to ask me anything about skin cancer, not skin, I'm not a dermatologist, but skin cancer. Hopefully I'll be able to answer most of your questions. And if really need to, you have a really pressing question about any other cancer, do just type it in, and we have time, we'll try to answer all of that. But most importantly, we want tonight to be useful for everyone who's tuning in. So let's jump in with the talk. Now, why skin cancer? So, a common question that's asked and people actually don't have the answer to is, what is the largest organ in the body, right? And immediately you start thinking, oh, the largest organ, what could be? You start thinking, what are the organs in the body? You think about the eyes, obviously not. You think about the heart, you think about the liver, bladder, kidney, all these sort of people think these are the organs. But actually, the largest organ in the body is actually the skin. So it's a bit of a trick question, because most people don't know that the skin is actually the largest organ in the body. So now you can go impress your friends the next time you meet up with them and ask them what's the largest organ, and I can tell you majority of them will not know the answer to that. So the skin being the largest organ in the body is obviously something that's very important, right? So what is skin, right? And in order to understand skin, you need to understand the different layers that make up the skin. So very simply, right, if you look at the layers of the skin, you have what we call, right, all these things, you have things like sebaceous glands, sweat glands, all these sweat pores on the surface of the skin. But right below the skin, the first layer called the epidermis is made up of what we call the squamous cell layer and the basal cell layer. And then below that is what we call the melanocytes layer. Now, a bit scientific, a bit technical, but it's important for me to introduce this so that you understand what are the 3 different types of common skin cancers that can happen. And it's easy to remember because they are cancers that happen to the different layers of the skin. So one of the more common types of skin cancers happens on the first layer, which is what we call the squamous cell layer. And so if you get cancer in this area, you get a skin cancer that's called squamous cell carcinoma. And then if you get a cancer in the second layer called the basal cell, then you get a cancer that's called basal cell carcinomas. So it's called that way. Well, these 2 cancers are called that way because they develop in those certain parts of the skin. So the basal cell carcinoma, for example, develops from the basal cells at the bottom of the epidermis layer of the skin. So the 2 most common cancers in Singapore really for skin cancers are really squamous cell cancers and basal cell cancers. So really tonight, the focus of tonight's talk is really just about these 2 cancers, because there is one more cancer, and I'll go into that now. It's called melanoma, which develops in the cells that produces melanin, and that's just the cell below those are the cells below the epidermis. Melanoma is very rare in Singapore. Okay, it is unfortunately also, however, while it's rare, it's also the bad boy among these 3. The real paikia of these 3. It is the most aggressive of all the cancers, but thankfully in Singapore, this cancer is very rare. Out of 100,000 people, only about 0.5 of them will develop that. So that's really a very rare cancer. So we won't talk too much about it. We will talk a little bit to give you a bit of knowledge, but melanoma is really something we see a lot in some Western countries, but less so in Singapore. Okay, so let's talk first about what are the risk factors of skin cancer. And this one is actually something that most people will know. It's actually ultraviolet radiation from the sun. So it's sun exposure. The large majority of all skin cancers develop because of ultraviolet radiation from the sun. So it is actually, sun can be, you always hear the word carcinogen, right? You're so worried about, everyone's worried about carcinogen. What am I eating? What kind of cancer causing things is this thing I eat? But actually, one of the worst carcinogens for the human body is actually potentially the sun. Ultraviolet radiation, especially prolonged sun exposure to ultraviolet radiation, can actually is the main cause of a common cancer like skin cancer. So knowing that this is one of the most important risk factors has changed the way completely, over the last few decades, how we try to bring down the numbers of skin cancer. So it's important to know that ultraviolet radiation can certainly damage the skin, and in the long term, that damage can lead to skin cancer. Now, there are certain characteristics, of course, that predispose people to sun damage, and mainly ultraviolet radiation or skin cancer develops mainly in very fair-skinned people or very, very light-skinned people. And that's probably one of the reasons why darker skin people do not develop skin cancer. But doesn't mean that they won't. Like I said, despite us being a predominantly darker skin population in Singapore compared to the Western world, we are actually have, like I said, like Andrew shared, right? We have about 6 most common cancer here in Singapore is actually still skin cancer. So while it's a myth that being darker skin protects you from skin cancer, so that's, if anything, a point can be hit home. Those of us who are tuning in who think that, I'm dark skinned, I wouldn't get skin cancer, that's actually a myth. It actually can still happen. It's just not so common. So you still have to protect your skin. Okay, now the other thing, this one people may or may not know, but if you might read about what we call different types of UV radiation. So there's UVB, ultraviolet B radiation, and ultraviolet A radiation. So ultraviolet A is actually a lot more common in the sunlight. It makes up about 95% of all the UV radiation that comes onto the Earth. And ultraviolet B is actually it's only makes up about 5%. Now, ultraviolet B is actually the one that causes most of the skin damage, and actually is the main cause of most skin cancers. But it's a myth, once again, that to think that ultraviolet A radiation doesn't do it. And they've done studies which, so a long time ago, they used to say, tanning, sun tanning beds, we don't do this much in Singapore, but in Western countries, tanning beds, right? Because they use ultraviolet A radiation, they say, this is very safe, it won't damage your skin. And that's certainly been proven not to be true, that patients were found that have a 67% higher risk for skin cancer among patients who've had a history of tanning bed use. So it's important to know that both ultraviolet B and ultraviolet A radiation can cause skin cancer. So we have to protect against both. Okay, other risk factors, right? Things I wouldn't talk too much about because most people do not have exposure to this. Radiation exposure, if you've had to undergo radiation often for cancer in your younger age, many years later, the part of the skin that was radiated may very well become skin cancer. And then exposure to certain kind of chemicals like arsenic and radon can also lead to skin cancer. Okay, other genetic risk factors. If you do have a family history of skin cancer, you are 2 to 3 times more likely to develop skin cancer. You can have this kind of rare inherited skin disorders. We wouldn't talk too much about this because these are really quite rare, but I put them out there. Perhaps the one that people do know about is albinism. When people are, albinos, they are more predisposed to getting skin cancer as well. Now, if you are always your body is chronically immunosuppressed, and these are really patients like HIV patients or patients who've undergone transplant or patients who are on chronic steroid use, immunosuppressed patients also have a higher risk of developing skin cancer. If you have certain skin conditions that are what we call chronic skin inflammation, not short-term, but very long-term skin inflammation like burns or ulcers that don't heal and what we call chronic ulcers, these can also become cancerous. And then also smoking and certain drugs, right, have been shown to increase their risk of getting skin cancer too. Okay, now, so knowing what are the risk factors, and we know the main risk factor that we can prevent is really ultraviolet exposure or sun exposure. So what are some of the steps we can take to make sure we limit our ultraviolet exposure? So this is very important. We do want some sunlight. Sunlight is good. It's good to be active. It's good to be outdoors. It's good for so many reasons. Vitamin D, good for the eyes. So we want you to be outside. But probably what is important is then don't go out during the times when the UV radiation is worse, which is really between 10 a.m. to 4 p.m. So try to be outside before 10 a.m. or after 4 p.m. And that's well known to be the periods where there's less UV radiation exposure. When you're outside, I know it's really hard in Singapore, right? But in other countries, if it was colder and all, you really want to be limiting the amount of sun exposure. So you might be wearing long sleeve, long sleeve tops, long sleeve pants, and when you're outside. Of course, in Singapore, I think that's not practical for certain days like today when it's like so so crazy hot. So, but you know what you can do is you can use certain types of clothing, what we call tighter yarn. So like you see, it's less of it is exposed to the sun, darker colors. And also sometimes they also have all these, you can buy from shops. They say they have special UPF factor, which is like a sun protection kind of factor for clothes. And the higher the level of that, the more you're protected from the sun. Okay. Now, sunscreen is very important, so I'll spend a whole separate slide on sunscreen. We won't talk too much about that. But sunglasses is also very important. Now, besides, of course, tonight's talk is about skin cancer, but we might as well talk, since we're saying protecting from the sun, we should also talk about the protecting the eyes. The eyes obviously needs protection from the sun, not so much because of cancer, but other eye conditions like cataracts and all that, right? Macular degeneration, all this, they can be affected by sun exposure. So it's important to also protect your eyes when you're out in the sun. And then also, very, very easy one, headwear protection. You know, when I am not working, generally, I'm almost always wearing a cap. Not because I want to protect myself from the sun, but because I'm lazy to comb my hair on days that I'm not working. But for everybody else, right, you really need to be wearing all these things. Avoid sun exposure, wear clothes to protect yourself from the sun, sunscreen, I'm going to talk about, sunglasses, and headwear protection. Okay, now I want to talk a little bit more about sunscreen and how to use it, because I think this is really the most important. Number one, most important thing about sunscreen is please use it. Now, it's amazing. I know that many people in Singapore in particular are really can't be bothered to use sunscreen, right? You know, for some reason, it's that message has never been hit home from young that we need to use sunscreen. When we were young, we just went out there, we never used sunscreen and all that. I think the only group of people who are very good at this are generally women, especially women who care a little bit more about how they look and want to protect their skin. You know, they're really the only group of patients that I ever meet, or people, the only group in our population that really makes an effort to use sunscreen to protect their skin from sun damage. Most of the time for vanity reasons, but in a way that's good also, because that also protects them from skin cancer. So most important message is, all of us, when we're out in the sun, we need to use sunscreen. Okay, Singapore has a lot of UV radiation exposure, so we really need to use that sunscreen to protect yourself. So I will talk a little bit about sunscreen, right, and what it means. Now, I think what you will see, obviously, most of you who are familiar with sunscreen, you'll see this thing called SPF, which is sun protection factor. Now, sun protection factor is just, it's actually quite technical, but it's really the amount of protection from your skin burning. If those of you who are very interested, it's like, if I can explain it, you know, it may be boring for most people. If it takes, like, say, it's the amount of time it takes for your skin to get sunburned. But it's a ratio. So meaning that, for example, if you put sunscreen and it takes 300 minutes for your skin to get sunburned, compared to when you don't put sunscreen, it takes about 10 minutes for your skin to get sunburned, then that ratio is about 300 divided by 10, which gives you an SPF of about 30. So that's what SPF 30 means. You know, it's basically how much time it takes for your skin to get, how much protection it gives to your skin compared to your skin did have sunscreen. Now, so you might think, well, then I might as well go for SPF 100 lah, if there's such a thing. You don't need that, okay? SPF 15 is the really bare minimum for just every day. You're not really out in the sun. You're just going out. You know, you're just spending like a couple of minutes between MRT stops and all that sort of things, or hardly under the sun. Even then maybe probably an SPF 15 may be enough, because that provides about 92% protection from the sun. But if you're going to be outdoors for work, for sports, then you really need a minimum of SPF 30, right? 30, because that provides about 97% protection from the sun. Now, SPF 50, you don't, even though it seems like, wow, from 30 to 50 is such a big jump, most of us actually don't really need SPF 50. It does provide a bit more protection, but you'll be amazed to know that it only provides about 1% more protection than SPF 30. So really, SPF 30 is adequate. SPF 50 is probably good if you are a bit lazy and don't really want to put a lot of sunblock. So SPF 50 will still be a little bit better, but you don't have to go and buy like SPF 50 and 130 is more than enough if you apply it properly. So the key isn't really so much the SPF rating, even though 30 is like the minimum for outdoor sports, but it's how you apply it. You got to apply it about 15 to 30 minutes before you're out in the sun, and apply it every 2 hours, because it washes off with sweat and all that, especially if you're playing sports. And apply it quite liberally, really all over, the face, the neck, all the parts that are exposed, the arms, the legs, all of these sort of places need to be protected. Okay. Now, you also see this thing called broad spectrum. Most sunscreens these days you'll see are broad spectrum, and that just means that it protects you from both UVA and UVB radiation. If it's not broad spectrum, most of it is really just UVB protection and no UVA. But broad spectrum would mean, so try to get broad spectrum because it protects you from both types of radiation. And then the last point is, generally for sunscreen, I always advise don't use expired sunscreen, because the way sunscreens work is that they actually like kind of active chemicals that absorb the sunlight, and that's how it prevents the sunlight from damaging the skin. If it's expired, these active chemicals may no longer be active, so you wonder whether it may still work. So for those of you who bought like sunscreen for your kids, because I think you're worried about your kids when they're very young, you always apply from them, and then they grew up and they can't be bothered to let you put sunscreen anymore. You left it there for many years, and then you think, hey, now I'm going to do some outdoor sports, and then you use it. Please check the expiry date, because if it's been a few years old or if it's expired, please don't use it. It's not really that expensive. You can get it from anywhere and get yourself a new tube, but don't use expired sunscreen. Okay, we're going good with time. We're about halfway through. So, and then I wouldn't talk too much about these medical ways of preventing it, but there are also tablets called oral retinoids for high-risk patients we use, and even chemotherapy that we can sometimes use for high-risk patients to prevent skin cancer. Now, I will just mainly say to you that there will be many, of course, everybody wants to talk about diet and every cancer prevention talk, and I'll just say up front, in terms of upfront for skin cancer, diet doesn't work. Diet does not protect from skin cancer. So whatever vitamins, whatever supplements, whatever kind of eat good diet that says it will protect you from skin cancer is never been shown to work. So diet is not the way. Sun protection is really the only way. Okay, so having talked so much about skin cancer, right? How will you know if you have skin cancer? So I think this is when I waited, probably now that's already 9 o'clock. Hopefully everyone has had their dinner, right, before I start putting up ugly pictures. So these are some examples of skin cancer. And I'll tell you right now that actually they are all squamous cell carcinomas. But you can see they all look quite different, right? You look at this picture and this one in the middle and this one, they all look completely different, and yet they are all different. They are all squamous cell carcinomas. And that just goes to show you that actually it can be quite hard for a lay person to pick up what skin cancer looks like. So this is an example of just to let you see some pictures of how skin cancer can look like. And then I want you to see these 3 pictures as well. And then if you are there and you're having a look, you're tuning in right now, and you think, oh man, what sort of cancer is this? Is this also squamous cell carcinoma? Is it basal cell carcinoma? Is it melanoma? If you guess if it's one of these 3, because those are only 3 skin cancers, if you guess it's one of these 3, you'll be wrong, because these are all very ugly skin lesions that look like cancer but are not cancer, right? So these can sometimes be mistaken for cancer, but they are things like what we call sunspots, or lay people call sunspots. And medically, we might call them actinic keratosis or solar keratosis. You have seborrheic keratosis, and this one is actually just eczema. So it's just to drive the point home that even something that looks ugly like that, right? You get really worried. You're like, oh no, I got cancer and all that. It may not be, but it actually is very difficult for us to tell what looks like skin cancer and what doesn't look like skin cancer. All right. So just to look at this again, these 2, right? If you look at it, it actually looks quite innocent, right? Compared to the first 3 pictures I showed you. But these are also skin cancers. So this here, the one on the left, is actually a basal cell carcinoma, and the one on the right is actually a type of melanoma as well. So the whole point, right, is it's almost impossible to tell on your own, and definitely not by Googling what skin cancer looks like, whether you have skin cancer or not. Okay, so what then do we look for? So it's a whole list, right? And I'll go through this whole list in very, very quickly. But look, the main thing I want you to know, rather than my list, right, and what are the things to look out for, is if you see something that worries you, go and see a doctor, because it actually is very difficult for anybody to pick up skin cancer. So just what are some of the things you do want to look out for? If you are a person who never had moles before and you suddenly develop a new mole, that's something to be concerned with. If you have had moles before and you find them increasing in size, that's also a little bit of an alarm bell, or to warn you. If you have you have a mole and that seems to, the outline of it becomes irregular or ragged, that's also an alarm bell. A spot, where it's not a mole, but you just know it's a spot, but it's changing in color. It seems to be changing in the variation of it, or developing a bit of a sheen. That's also something to watch out for. A spot that suddenly becomes raised or develops a lump within it. The surface of the mole becoming rough, scaly, or ulcerated. Moles that are itchy or tingle. Moles that bleed or weep. Spots that look different from others, and sores that never completely heal. So these are all little alarm bells. It may not mean it's cancer, but they are enough. If you have any of these, you should not ignore it. Okay, so the main thing is, if you see any of these alarm bells, go and see your doctor to have it checked out. Okay, now, so the I guess for most people, the first person you kind of see is your GP, or your polyclinic, and for all these little spots. So as long as you see something that worries you, go to your GP, go to your polyclinic, but most of them will refer you on to a skin specialist, what we call the dermatologist. So dermatologists don't just make you look beautiful. They look after very important medical problems, and skin cancer being one of those very important medical conditions that they look after. So they do most of the treatment for skin cancers, and most of them, when you have a suspicious skin spot, they will examine the skin spot using a dermatoscope, and then if they think it's suspicious, most of them will do a biopsy. A biopsy is just is illustrated in this picture here. They basically take some tissue out to see and confirm. So it's skin cancer. How we know what sort of cancer it is really through biopsy. So that's how we know whether it is whether it's confirmed skin cancer and what type of cancer it is. Okay, now we'll finish up with talking a little bit about treatment. And like I said, we probably only just a few more minutes. I'll just quickly talk about treatment. Now, because skin cancer is mostly picked up very early stage, and also because the two most common skin cancers, the squamous cell carcinomas and basal cell carcinomas, rarely ever spread to the other parts of the body. Most of them can be taken out with surgery. So I'll show you a video later on how surgery can be done for skin cancers. For some very low risk superficial cancers, we sometimes do non-surgery, and we show you an example of what cryotherapy looks like. Now, things like radiation therapy and targeted therapy, where I look after these patients, actually is not that common. So I'll talk to you a little bit, but not too much about them. Okay, so let's see an example of how skin cancer surgery can be done. And one of the ways in which we can do is this particular type of surgery called Mohs micrographic surgery. So let's have a look and see just how that looks like. Okay, so enough of my talking, and then we'll go to a video to have a look.
The warmth of the sun feels good on our skin, but overexposure to the sun's rays can be dangerous. UV radiation can penetrate our epidermis and damage the DNA in our skin cells. Over time, this can lead to skin cancer. Skin cancers are like icebergs, with the tip of the tumor visible above the skin and the bulk of it underneath. There's no way of predicting the extent of the cancer growth before treatment begins. Sun damage is the most common cause of basal cell and squamous cell carcinomas, both of which are on the rise. Mohs micrographic surgery is usually the most effective treatment for the common areas where these skin cancers appear, the sun-exposed areas of the head and neck. Performed on an outpatient basis, Mohs surgery significantly reduces damage to the surrounding tissue while effectively removing all traces of cancer. First, your fellowship-trained Mohs surgeon marks the tumor with a pen. While there is no need for the patient to undergo general anesthesia, patient comfort is a priority. So before the Mohs surgery procedure begins, the affected area is numbed with a local anesthetic. Then the surgeon excises a saucer-shaped piece of tissue with 1 to 2 millimeter margins around and below the marked border. Hatch marks are made on the skin to maintain specimen orientation. A bandage is placed over the patient's surgical site, and he or she will wait comfortably while the excised tissue is taken to an on-site lab where it's prepared for microscopic evaluation. Many Mohs procedures can be completed in several hours, but some cases will take longer. Your fellowship-trained Mohs surgeon, who has training in skin pathology, carefully examines the tissue under a microscope to see if the cancer has been completely removed. If residual tumor is found, it's marked precisely on the map. A second Mohs layer is excised only in the positive area. This process is repeated until all the margins are free of tumor. Your fellowship-trained Mohs surgeon will explain the most effective means of surgical site closure and post-operative care at the time of your procedure. Small, simple wounds in appropriate areas are allowed to heal naturally by a process known as second intention. Most wounds are closed with a linear repair, a side-to-side stitching of the surgical site. To close a circular wound, extra tissue on either side of the circle is trimmed so that the suture line lies flat. Larger or more complicated wounds may require skin grafts or a flap, which closes the surgical site by moving adjacent looser skin to fill in the wound. There will be some scarring once the area is healed, although scars from Mohs surgery are often smaller and less visible than those from other excision procedures. As a member of the American College of Mohs Surgery, your Mohs surgeon has undergone.
Okay. All right. So that's Mohs surgery, which is usually not really the most common surgery for removal of skin cancers. Most of the time, it's really just normal excision done by a dermatologist in their clinic. Mohs surgery is done by certain dermatologists in Singapore, but it's really only used for generally more sensitive areas like the face, near the eyes, and all that. But if it's just on the arm, the legs, and other parts of the body, usually you don't have to undergo such complicated surgery. You do simpler surgery, which can even be done under local anesthetic in the clinic. But I thought I'll show you that because it's quite an interesting way of dealing with skin cancers. We will see another video now because like I said, some people may not need surgery for very superficial kind of cancers. And in this kind, we can do things like even just freezing or what we call cryotherapy. So we have a quick look at a short video on what cryotherapy looks like.
Cryosurgical procedures. Cryosurgery is a powerful and versatile technique for the treatment of many types of skin lesions. Today, we will demonstrate a variety of cryosurgical techniques using liquid nitrogen as a spray and with cryo tweezers. While some conditions will respond to a single treatment, it is not unusual for warts to require more than one treatment session. Cryosurgery with liquid nitrogen is performed on the common warts found on this girl's finger. A bent tip extension spray is being used to attenuate the flow of liquid nitrogen and make it less painful for the patient, especially around the nail fold. The warts are frozen to the edge, including a small halo of normal skin. Each wart is frozen twice to get optimal results. On the second application, the liquid nitrogen spray is pulsed to demonstrate how a pulsatile spray method allows for good control of the delivery of the liquid nitrogen. Cryosurgery is being performed with a Cryac tracker cam to treat a large seborrheic keratosis on the forehead. As the skin temperature drops below 0 degrees centigrade, the sensor light turns green. This SK is treated using a spray paint method, taking special care to fully freeze the periphery of the lesion. Cryosurgery is being used to treat an actinic keratosis on the face with a bent tip extension spray. 10 seconds is usually an adequate freeze for thin actinic keratoses. A cryotweezer is applied to a skin tag on the neck until it turns white to the base of the pedunculated stalk. A second skin tag is treated in the same manner. Note that the cryotweezer is held with cotton gauze to avoid freezing the hand of the physician. As demonstrated, cryosurgery is an excellent method for treating benign and premalignant conditions of the skin. Liquid nitrogen is the preferred cryogen and can be applied as a spray.
Okay, all right, I'll stop there. Okay, so as you can see, cryotherapy, right, really is mainly used for benign lesions like warts and sunspots, skin tags, and all that. But for skin cancer, only for very superficial early stage cancers, we can sometimes use that. But the large majority of skin cancers actually require surgery rather than a non-surgical procedure like cryotherapy. Okay, and then finally, we just quickly talk about advanced treatments for, treatments for advanced cancers. And really, this is really melanoma because that's the most aggressive of all the skin cancers. So much less common compared to squamous cell carcinomas and basal cell carcinomas. And yet they cause about 75% of all skin cancer deaths. And the reason being that they spread to other organs much more than the other types of skin cancers. So for melanoma, it's where the biggest breakthrough over the last 10 years happened in using things like targeted therapy tablets. These are now changed the treatments for for melanoma, and then also immunotherapy. Many people who have tuned in before will have heard of immunotherapy, whereby we use the power of the immune system to fight cancer cells, and that has been even though immunotherapy is now so well known and used for so many cancers, actually the first cancer where it was proven to work was actually melanomas, which is a skin cancer. And at that time, about 10 years ago, it was all the buzz because we suddenly found all these amazing results for melanoma. Patients used to live for only about 6 to 12 months once it's stage 4. But then all these patients were having just amazing responses, and they would then live. We even saw like long-term cure rates for what was used to be a lethal type of cancer. And so the scientists, the doctors who came out with immunotherapy actually won a Nobel Prize a few years ago. Immunotherapy, this is really how it works, by activating our immune system to fight the cancer cells. This is an example of, so why I'm actually asked to give this talk is because I did a lot of these trials in Australia at that time, over 10 years ago, in all these melanoma patients. This is an example of a melanoma patient who this was his PET scan. We can see cancer spread everywhere, and only after just a few rounds of treatment, right, like 2 weeks later, this was his PET scan, and almost all the melanoma had disappeared. This was that patient. You can see all the melanomas all in his skin, all over his body, and likewise 2 weeks later, this is how he looked, like almost like a baby skin. So that's how an immunotherapy really took off from there, to now be used for so many cancers and having just as amazing responses in many other cancers as well. But melanoma or skin cancer is really where we found out how effective immunotherapy can be. All right, so really that's it. This is the last message for tonight. I think, like I said, once again, why I'm asked to give this talk, right, is because I actually train in Australia. And in Australia, that's where skin cancer is actually extremely common. And when I had no idea about all this skin cancer prevention message until I got there. But the moment I went there, everyone where I went, everybody was telling me slip, slop, slap. And that was the message when I first went to Australia in the 90s. But since then, they've added 2 more slogans to that, which is really slip, slop, slap, seek, slide. And what does that mean? Slip on a hat, which is all the things I told you to prevent cancer. Slip on a hat, slop on, slap on, I can't remember what slap on is. Slap on some sunscreen, and then seek shelter like an umbrella, and then slide on a pair of sunglasses. Slop will come back to me in a moment. Slip on a hat, slop on, I can't remember. Anyway, you'll come back later on. I'll bring it up when we are talking to the chat, when they're doing the chat. Okay, so I think that's really it. Andrew, you want to we can invite you back again, and then we can do the question and answer.
Sure. Thank you very much, Dr. Yip, for the very comprehensive and informative content. I definitely, we're sure that the slop thing would probably come back to you, right, in a short
Yeah,
moment as we go on to,
go black.
uh, interacting with our audience for tonight,
Yeah.
right? So I hope everyone has also picked up some useful tips earlier on, right? So really, right? Wear your sunscreen, as they say, even in the states, right? And it's just something that we put on, probably. I guess for the guys who have gone through NS, putting on all those ugly camouflage paint on their face, right? Is kind of a disgusting thing, but it's necessary. If not, you get punished. So I think it's the same thing. If you go out there, try to put something on your face, sunblock, sun protection. I think it's really useful, especially we live in a tropical or tropics country like Singapore. It's always so sunny, right? So remember, folks, early detection saves lives. And yeah, for tonight's context, really wear your sunscreen, right? So now it's time for the most anticipated segment for our Facebook Live talks, which is the Q&A segment. So I hope everyone got your questions ready. We had a very interesting question from Jasmine, right? I guess she's a recreational diver. She does probably a lot. That's why she asked the question to say that, yeah, my diving instructor told me that sunscreen is bad for the marine life, right? So told them not to use sunscreen. I suppose the diving instructor is probably worried also about water pollution, right? Where you dive, if you have too much of sunscreen goes into the water, it probably kill the corals and marine life, I suppose. Is that any truth to that? Or is there
Yeah.
organic, so-called
Well,
environmentally
you know,
friendly sunscreen?
yeah, I guess probably true. I guess I wouldn't know the answer to that. In the how harmful it is for marine life. It is a chemical,
Mm,
but if you are diving a lot, you really need to protect yourself, right? So I think if you're diving, you're going to be exposed to so much sun. It would be, if it's something that you do regularly, I would find it, yeah, it would be a little bit negligent for you to
yeah.
not protect yourself. So despite the possible effect on marine life, we know are the obvious benefits of sunscreen, and so you really need to be protecting yourself. Whereas the one on
Mm,
marine life, it's probably not as proven, or we don't really
mm,
know, how much it will affect it.
yeah.
But
I,
we
I
know for
I don't know,
sure.
man. I mean,
Yeah,
Dr. Ip, because if you are diving, I would say in my judgment, probably the amount of sunscreen that you wear or put on will be quite minimal because you'll be
the clothes
wearing your full
most of it.
diving
Yeah,
gear with your
yeah,
gloves, your
true.
your
Yeah,
flippers and so on,
yeah,
versus
yeah,
somebody who is doing snorkeling, right?
yeah,
Probably
yeah,
in their bikini
yeah,
or just their trunks.
yeah,
Yeah, probably that person who is snorkeling would probably have to wear a bit
yeah,
more sunscreen. Yeah,
yeah,
but
yeah,
I guess that's something that we can all look it up, right? If
yeah,
we are very cautious about protecting the marine life, right,
yeah,
and not polluting the beautiful waters that we have around us, right?
yeah,
So yeah,
yeah,
so let us know. I mean, we will be happy to know if there's, I mean, sunscreens out there that is organic or perhaps more environmentally friendly and not harmful to marine life. Yeah. So give us a text or a message if you happen to know the answer. Now, then we have questions from Joanne, right? Joanne said asking for prolonged sun exposure with sunscreen on, with no sunburns after hours of sun exposure. Does it still increase the risk of skin cancer,
yeah.
or is it?
So the important thing for prolonged sun exposure, right, is you need to apply your sunscreen after 2 hours, because a lot of sunscreen wears off after 2 hours, whether it's your sweat, or you rub it off and all that. So if you're out there for like 10 hours, right, or 6 hours, and you've only applied the sunscreen once, it's not really going to protect you after 2 hours. So even if you don't have any sunburn, the skin, because of the nature of the type of your skin that you have, where you're not so fair skin and you don't burn so easily, your skin will still be damaged. But of course, all these sort of things, having a bit of sunscreen is still better than no sunscreen. And also, it's if you do it once every few years, when you take your annual trip to, I don't know, some beach holiday, it's probably not going to be a lot of damage. It's really the cumulative as well, sun exposure, that makes a difference. So that's your everyday kind of exposure, so it's not going to cause a lot of increased risk in your cancer if it's only a prolonged sun exposure once in a while. So it's really protect your skin, but slip on the or slop on the slap on the slap on the sunscreen as much as you can. I know what slip slop slap is now already, because I got it now. As I say, now I know why I got myself confused. Is because I said slap on a sunscreen, which is wrong. It's actually slip on a shirt, slop on the sunscreen, and slap on a hat. So that's why I got myself confused. Okay,
cool.
So we knew it would come back. so yes, but you do need to protect your your skin from all these sun exposure as much as you can. But it does depend on a lot of factors, like I said, how much sun exposure, how often, the cumulative sun exposure, and your type of skin as well.
Yeah, I suppose so, because I still remember, many years back when I was traveling to Japan. Something always comes to my mind, when I see the Japanese ladies or female drivers, they're always driving around with a sun visor, and so-called sleeves, or wearing long sleeves and even gloves as they're driving. So, out of curiosity, I asked them, I say, why do you all, have to do so much? You're just driving. The most you probably have one hand more tan versus the other. They say no. I mean, it's really sun protection. So you really have to hand it to the Japanese ladies, that they really go all out, to protect themselves with getting.
Actually, you don't have to go to Japan. Even here, the Japanese ladies, the Korean ladies, right?
Yeah.
I run at the Botanic Gardens, and there are some of them who, I mean, when I run, I get hot so easily. So I do put on sunscreen, but I'm normally wearing a singlet and shorts, And then there are these overseas expat women, right, who look as if they're dressed for winter, and they are running. I'm always, I marvel, but that's the effort they take to protect their skin. So I do admire that, because I could never do that. I just put on I get too hot.
People do go to extreme length to somehow to be safe and also protect themselves. We got a question just now. You're talking about putting on sunglasses or wearing sunglasses. So I think transition lenses are getting more popular or common. So does it also achieve the same protection or effect as a typical sunglass?
Yes. So as far as I know, I'm not for protecting from the eyes from like normal damage from which causes like things like cataracts and all that. I think transition lenses are still better than whether it's effective as sunglasses, I don't know, but it's definitely
better than nothing, right?
Nothing. Yeah.
Okay. All right. So we have a question from Sally. I'm not sure whether this question is down your alley or is better for a dermatologist, but here goes. Right. She was asking how to prevent skin tags from growing out after removal.
Yeah. So ask a dermatologist. Sorry, Sally. I actually purposely met up with a dermatologist, right? I said, tell me the answers to all the non-cancer questions. Just give me and I said, give me half an hour, because I know tonight surely there will be people will ask me questions which are not cancer related, which I wouldn't know how to answer. And she endeavored to talk to me about anything, but she didn't give me the answer to this question: how to prevent skin tags. So I don't know. I'm sorry. I am a medical oncologist, so I generally I really don't see. By the time the skin cancers come to me, they're very advanced and very jialat. Even the early stage skin cancers generally don't have to see me. So when they are not even cancer, right, they don't even come within a kilometer of me. So I really don't know the answer how to prevent skin tags from growing.
I guess to that is really the dermatologists when it comes to anything regarding our skin, they are really our first line of defense, right? You
Yeah,
you you
yeah,
you, you go to a polyclinic, you have acne
mm,
or what have you not, right? Anything to do with skin, the GP at the polyclinic will probably refer you to National Skin Center. And from
yeah,
there, if you think that the dermatologist there is not as good or the queue is too long, you have to wait too long for appointment. Yeah, you can always find plenty of private dermatologists around, right? That would actually help you. But of course, we also don't really want you to go to the extreme that hey, by the time you see a doctor, and it's for skin cancer. So yeah, have it checked out if you have any doubts about it, right?
yeah,
Have it checked out by a dermatologist. I think they won't hold you back
yeah,
if they need to refer you to a proper oncologist or a specialist, if they suspect that it's going to be a skin cancer, right? So I hope, Sally, you can take that question to a dermatologist of your
yeah.
choice, or yeah, hopefully you don't ask for Dr. Yip's dermatologist contacts, right? We don't do that here. All right. So the next question we have is from Renee. Renee says that she has a family history of a lot of moles going on her body. So do I
Yeah.
need to be concerned?
Sure. I
Yeah.
think if you have family now, if it's just a family history of a lot of moles growing on the body, but none of them have ever turned out to be cancerous, you don't have to worry. But if you have a family history of family members who've had a lot of moles and some of these moles turn out to be cancerous, right? Then you do need to be concerned in that you do have a higher risk of getting skin cancer compared to somebody who doesn't have a family history of skin cancer. So the main thing is that if it's just family history of moles, but none of it cancerous, don't worry too much. But if it's some of the moles in your family members have become cancerous, you do need to be a bit more vigilant and make sure you do all the protection regularly. Now, for you as well, of course, then if you have a family history yourself, but you yourself have no moles, then of course, a bit easier to look out for new ones that come out. And if you do see any, just watch them closely. And if they're changing in shape or size and color and all that, then it's something to be checked out. But most of the time, if it's just moles, don't worry too much.
Yeah. I suppose sometimes we are also been told, as we grow older, right, there's this so-called what they call the elderly spots, right? We tend to notice that there's a bit more moles or, discoloration on our skin as a person grows older. Or in Chinese, we call it 老人斑, that kind of thing. So yeah,
Yeah,
some people do get a bit freaked out. It's that. I mean, but I
yeah,
suppose yeah, some may say that that's a natural transition, from as you mature, getting older, in life,
yeah.
right? All right, we got a question from Meng Hui, right? Meng Hui says, during his NS, well, which was quite some many decades back, right? He has, sprained his foot and just rub it with some Chinese medical oil, and that part of the foot now becomes always very dry and dark in color and also itchy. So I've seen a GP. So is that any reasons to be concerned about, for that situation?
Okay. Okay. So a few things here. I think you're gonna need to find out why it's still getting dry and itchy. Obviously, I don't think that's a cancer related thing, but
Mm,
you could have just sensitive skin. You could be sensitive to the Chinese medicated oil. I don't know whether that's something you're
mm,
still using, but important
mm,
to maybe just find out what the reason for the itchiness and why it's turning dark. It's important to find out why lah. And once
mm,
again, not me lah, sorry. It will
yeah.
be the dermatologist because it doesn't
Mm,
sound like cancer, but it's certainly something a dermatologist could help you with.
mm,
Um, Now, once we know why, then I guess we can answer the question as to whether we think it will turn cancerous.
mm,
But generally, if it's just skin change in color, just dry, that's not going
mm,
to that's not going to become cancerous
yeah,
lah.
yeah,
Uh, if it's some other unusual condition that causes like inflammation of the skin over a long term, then yes, that may have a
mm,
small risk of becoming cancerous.
yeah,
But in most cases, um, you know, just dry skin and big pigmentation changes, that alone is not going to increase, not going to turn cancerous lah. But still,
Mm.
important to try to find out
Yeah.
what the cause of it, why the color is changing, and
Mm.
uh, and the person that can guide you the most is probably a
Mm.
dermatologist.
Yeah. Yeah, I mean, if I may offer my layman perspective to it, because sometimes if we, apply lotions or creams or even some of such medicated oil that's bought over the counter, all right, or from the shelf, sometimes because our skin nature may be a bit more sensitive, right, or it's a bit thin, as they call
Yeah.
it, right? If too abrasive, right, or too aggressive, right, when it comes to those lotions or creams, it may cause certain irritations and also certain so-called burnout of the skin. So thus
Mm.
it becomes dry, right? Because your skin kind of loses its natural water retention or things like that. So yeah, so of course over time it will have some form of discoloration. But like what Dr. Yip says, best if you are very concerned and you probably want to kind of even out the coloring of that particular patch on your foot, it's best to see a dermatologist, right? I suppose they will have some form of whitening cream or moisturizers to actually help you alleviate the problem. All right. So yeah, that's my layman perspective, right? And yeah, a lot of the times, I think as what Dr. Yip says, right? A dermatologist would probably be able to address your questions and your doubts about your skin problems, right? And by the time you go to Dr. Yip, I think it's something worth seriously look into, right? But for generally though anything to do with skin problems, a dermatologist would be able to rectify them for you, right? So that's also the same suggestion to Alex questions about skin tags on the face, whether it can be burned by facial service company, or I suppose you are referring to those facial salon, right? That helps. I mean, in the neighborhood that helps you to do facial and things like that. We are not going to be able to judge on that whether it's safe or not, because there's many different treatment out there, some using lasers or what have you not. So I guess if you are worried about whether it's safe or not, go to a more reputable dermatologist, or you can always get yourself an appointment at National Skin Center, right, to have it checked out. All right. So Lydia has a question about wearing sunblock or putting on sunblock, and it will block away vitamin D, which many people says, yeah, vitamin D is good for us. And her follow question is, oh, so before 10 a.m., right, and after 4 p.m., so does it means that we still need to put on a sunscreen or sunblock?
Yep.
Yeah.
Great questions.
Um,
I was hoping hoping nobody will ask me about the vitamin D question. Yes, you're right, Lydia. So with sunblock, it does block away vitamin D. So that's always the what we call the conundrum.
Trade off.
And that's the word I just taught my son last week. Conundrum, right? Meaning that it's like a difficult problem to solve. You're absolutely right. When we put sunblock, it actually prevents our skin from absorbing vitamin D. So in trying to prevent skin cancer, we are making it potentially another problem, which is the absorption of vitamin D. And now vitamin D, of course, is extremely important for the bones, so that you don't have weak bones or osteoporosis when you're older. So that's why the only way to get around it is two ways, really. We can make sure we try to, and actually one of the answers is that your second question about before 10 a.m. We try to limit the amount of sun exposure, but when there's less UV radiation, and that's before 10 and after 4. So you get some sun exposure at a time when there's less UV. But of course, actually, the advice before 10 a.m. is still to use sunblock. So either way, when we do limit our amount of vitamin D exposure. And the problem with more darker skinned people like Asians is that we already don't absorb vitamin D very well because of the nature of our skin. Whereas the fair skinned people, while they burn easily and get skin cancer more easily, they actually absorb the vitamin D better as well. They absorb the sunlight better to convert it to vitamin D. So for us, right, we actually have to consider vitamin D oral replacement. So it's one of those vitamins that we actually do prescribe a lot because many Asians are very vitamin D deficient. So while the sun is great, the natural way of is getting vitamin D, it does increase your risk of sun damage to the skin. So oral vitamin D is one of the ways we try to make sure everybody has enough vitamin D because we also don't want them to damage their skin. So the answer is vitamin D through the tablets. And then before 10 a.m., the answer is we still actually advise sunscreen, and because there is still UV radiation, just less. But if if you don't, it's not going to damage your skin as much as the other times, lah.
I'll probably be sounding like a broken record about saying this, right? Do everything in moderation, right? I mean, when we are talking about colon cancer, similarly, people ask about processed food, barbecue, and stuff and all. So it's always about a balancing act, or eating or doing things or eating things in moderation, lah. All right. So too much of anything is probably may not be too good, and or of course overdoing it. All right. So I guess we can't have the best of both worlds. I mean, sometimes that's life, right? So yeah, and Lydia also asked whether a CT scan can actually pick up skin cancer.
Yeah, so no, it can't, unless it's very advanced, like melanoma. But generally, a CT scan will not pick up skin cancer. So we don't really send patients for CT scans. And if you're just doing a regular CT scan, it's often too small and too superficial to be picked up on a CT scan.
Yeah. So whichever doctor, Lydia, is asking you to go for a CT scan, to say, to check for skin cancer, I think that doctor probably deserves a slight slap on the wrist from you to say, hey, I think that's not a good recommendation. So, right. So be a bit more discerning about some of this information or so-called treatments that's out there. Sally has another questions about if the family history have no skin cancer but have a history of a relative, is there a cause of worry?
Sally may need to rephrase that question. I don't quite understand.
Right.
So you have no one in the family has had skin cancer,
but a relative has.
Okay, but okay. So I guess maybe you mean a distant relative, is it? I assume family history you mean as in no one in the immediate family has, but maybe a distant relative has lah. If that's your question, then your the more distant it is, the less your risk lah. And the more closer the relative, generally the higher your risk of getting any cancer. So, but if that's not your question and we've answered the wrong question, then do type in the question.
Let us know and elaborate further on that. I perhaps have a final question, about humidity. So does humidity plays a part in whether increasing the risk of skin cancer or so-called having even things like sunburn or things like that, or for protection? Because I mean, they are saying that certain countries where the humidity is much lower as compared to Singapore, so the likelihood that you get more UV rays are much higher, so that's also increase your chances of skin cancer. Is there any correlation to that?
Well, not humidity lah. So humidity definitely doesn't affect skin cancer. It just so happens that the tropical countries, right, which are more humid, have a lot more sun exposure. We don't have winter where our days are short, where we just have sunlight throughout the whole year. And so tropical countries are like that, but it's not the humidity, it's actually the sun exposure. Whereas like northern countries, which are obviously drier, but they have seasons where they have hardly any sun exposure. So they have less sun exposure, but it's for those reasons rather than the humidity that why certain countries have more sun exposure. But genetically, we also have less because of the way our skin is. So there's many factors, but humidity isn't one of them.
Okay, cool. All right, so I guess that's all the time we have for tonight for the Q&A segment. So once again, thank you everyone for your participations and also the many questions that you have for our guest speaker for tonight, Dr. Yip. And for Dr. Yip, thank you very much for sharing and helping our audience who have tuned in tonight with their questions. So, and I really hope that everyone, got the information that you seek out, in regards to skin cancer, right? So now it's for our speaker, Dr. Yip, to take his break. Once again, thank you very much, Dr. Yip, for joining us tonight. We'll catch up again real soon, right? So, and we hope that everyone, like I say, has a better understanding about skin cancer and how to keep it at bay, right? So, as we move on to the next segment, right? So, for some of you who may have more questions to ask the doctors from Icon Cancer Center, or we should know more, then you must really do a yamcha with the doctor, right, in this wonderful closed group online workshop that is organized by both 365 CPS and Icon Cancer Center. So if you are interested in joining us on this Yamcha with doctor's session, do scan the QR code that's currently on screen right now. We have very limited slots, so do sign up early. And if you would like to know more, you can always drop us an email, right, regarding that. Now, we would also greatly appreciate it if you could give us your feedback about tonight's session and also what other topics you would like us to feature in the future. So do scan the QR code on screen in order to leave us a comment and give us your feedback. Now, of course, right now is for the winners of our Facebook contest. I must say this one, I'm not sure. Did we let the cat out of the bag, or it's just two easy questions, or you guys simply has been pick out a lot of tips and information from our social media pages and also our Facebook live talk. So it seems to be a very easy question for all of you, judging from the responses that have come in so far, and the number of comments and answers that we have received. So thank you very much, everyone, for your participation. So the winners for the last Facebook contest are, right? Can we have the winners? The winners are Jin Chuan Ho, Caroline Lin, Jem Quack, Miko Lim, Grayson Wong, right? So these are our 5 winners for the last Facebook contest. So for the winners, we'll be contacting you how to collect your prizes. Okay, so those who come and collect will also be getting more than just the promised prize alone. So definitely lots of goodies that we are going to throw in. So please be patient and wait for us to contact you soon. Yeah, and if you are not feeling that well, right? So do let us know, and we will certainly keep the prices for you. So don't come down if you are not feeling too well. And for those who know where our old home or old office is, please do not go there because we have, or rather, we will be moving to our new home, right? Tomorrow, right? From tomorrow onwards. So stay tuned, all right, to our Facebook page, our social media pages, and also our websites to find out where our new home for 365 CPS is going to be. And of course, we will also notify you the address, all right, for this 5 prize winners, right, to come down to our new office to collect your prizes. All right. So our next Facebook live talk session, right, will be in Mandarin, and it will be about ovarian cancer. So do share about it with your kakis, and if you can, join us together with our speaker, Dr. Lim Xiao Lei from OncoCare Cancer Center on 21st of May at 8:30 p.m. Once again, over our Facebook page, platform. Right, more info about this session is currently on flash on screen, so do remember to join us then. Now, lastly, for more information and to stay up to date about 365 CPS and Icon Cancer Center, our activities and events, do visit both of our official websites. Follow us on Facebook, Instagram, and Telegram. And don't forget, once again, to like, share, and comment on our pages so that more people can benefit from our charitable work and services. Now, once again, from everyone at 365 CPS, thank you very much for joining us tonight. And I hope that you all have enjoyed tonight's session. And we look forward to seeing all of you once again in our next session. Do take care, stay safe, and good night. Bye.